imagine having to be amputated because hospitals lack the capacity to perform orthopaedic surgery. Well, this is the case at the Frere Hospital in East London. And according to the province's Department of Health, some patients may even face long waiting periods of up to 10 years for the surgery. Now, eNCA reporter Ronald Masinda is tracking this story for us and its developments. So let's cross over to him now for the latest on this. And Ronald, a very warm good morning to you and big congratulations to you, colleague, and Ngeba Ntlanganiso, scooping the Vodacom Regional Awards. Had to, of course, give you your flowers while you can smell them while on air for the amazing work that you are doing. So congratulations to you. We bow down to your work, colleague. And I suppose this is also one of the work that you're bringing to us to the fore when it comes to health in East London. Quite concerning what we're hearing from what patients and residents are going through.
Good morning, Tumelo, and thank you very much indeed. Well, this has been an ongoing issue for several years now, and I'm just going to describe one of the people that we spoke to and his own experience. Now, this gentleman back in 2017, he was involved in a horrific accident where he also sadly lost his 3-year-old child. Now, he was also badly injured and needed surgery immediately, and he says that this process took couple of months so that he could get the surgery that he needed. He said he was thrown from pillar to post initially, where he was admitted to Cecilia Makiwane Hospital and then to Frere Hospital, and then he was in such pain that he kept telling doctors that he cannot handle this anymore. He's got this emotional burden that he's going through, having lost his son, and now also the physical pain that he had to go through. And eventually, when the procedure was done, he had to pay well over 100,000 rand, and that was from money from the road accident fund that helped him complete this procedure. But what we understand, and that's according to the Democratic Alliance as well here in the province, they've been probing as to why are these delays allowed to go so long. And the Eastern Cape Health Department also admitted to me this morning that they are faced with this burden and that they are trying to also equip more orthopedic surgery doctors to get the necessary skills so that they can be on board to shorten or reduce this backlog. But this is what Jane Mary Cowley had to say from the DA earlier when we heard from her.
In terms of whether the department is addressing the backlog in payments to suppliers, I do think they are making an effort to pay their medical suppliers. But unfortunately, by the end of September of this year, halfway through the financial year, they still owed medicine suppliers in excess of 600 million rand, 628 million rand to be exact. So what they do is they ring-fence money from funded posts, and they use that money to settle their debts to creditors.
It seems like, what we're hearing here, Ronald, is also that there seems to be financial, backlogs and debts that are incurred, which it's a cycle, right? It's a vicious cycle that at the end of the day, it's the patients that are bearing the brunt and unfortunately cannot have these surgeries performed on them.
Yes, indeed. And during this financial year, the budget for the Eastern Cape Health Department was also reduced. And this has, of course, exacerbated some of the issues that they've been faced with. One of the main ones has been the medical legal claims that the department has faced, people suing the department for negligence, as well as lawyers, unscrupulous lawyers benefiting from these legal claims that has cost the department billions of rands over the past few years. And not only that, I mean, short staff shortages in hospitals has also been an issue where a lot of the operations have not taken place on time. We've also heard of issues at Livingston Hospital where in some instances parents who are about to give birth, they have struggled during labor because of issues such as staff shortage. But the other issue is the burden that the department faces in paying off its debt, and many of the people or many of the businesses, the service providers that are owed are essential services, which cannot be the case in this day and age where so many millions are owed to service providers, and yet they are the reason why people might be experiencing situations of life or death. So this department says that it has managed to try to reduce its death drastically, but a lot of more work still needs to be done.
All right, we'll keep a close eye on these matters and more, and hopefully get some comment as well, even from the authorities themselves. eNCA's Ronald Masinda, thank you so much, colleague, for bringing this story to the fore. Quite a big one in terms of the backlog we're seeing there, but also the impact that this lack of orthopaedic surgeries now has on patients out in East London.